Okay, good morning, everybody. So let me introduce myself. I'm a general medicine physician, and I have postgraduate qualifications from India, from United Kingdom, and from USA. I've been practicing medicine for nearly 50 years. In USA, behavioral science is also a part of the medical curriculum. So I got the training in behavioral science. That one makes me feel comfortable and an expert in giving talks on behavioral science. And in the past 30 years, I had the opportunity to work with mental health professionals like psychiatrists and psychologists. I must have worked with nearly 30 mental health professionals. And my patient panel, again, 15 to 20% of patients, they had mental health problems like depression, anxiety, post-traumatic stress disorder, bipolar disorder, schizophrenia. I had to manage all those patients. And in the past 3 years, I must have given more than 100 Zoom talks on more than 100 different topics. So today, I'm giving this talk because Dr. Sridhara Krupp, last week, he made that request. So I'm honoring his request, give a talk on vitamins. So let me start the first slide. So I assume the slide is visible and I am audible. The topic is hypovitaminosis and hypervitaminosis. The word hypo means low. When the blood pressure is low, we call it hypotension. When the blood pressure is high, we call it hypertension. The glucose also, if the blood glucose level is low, we call it hypoglycemia. High hyperglycemia. So the talk is about when the body, the vitamin level is low, what will happen to the body? And if it is high, then what will happen? Purpose of this talk, know the essentials about vitamins. Know the source of vitamins. Know the impact of hypovitaminosis. Know the impact of hypervitaminosis. Too much information can cause too little absorption. Less is more. And I have learned from giving so many talks and listening to so many talks. It doesn't make any sense in overloading you with a lot of information and facts. And especially age also, I have to take into consideration. Our poor Sridhar Krupp sir, he is 70 plus, and there are many other people who are 60 plus. At this age, is not easy. Too much information that will create mental indigestion. So I'm not going to talk about everything I know about the vitamins. And deliberately, I am not going to talk about certain things because this talk is about what is absolutely essential. What is vitamin? A nutrient that the body needs in small amounts to function and stay healthy. In small amounts, that is the most important point. Should I take vitamin supplements? Now, I would like to know how many of you in this group are already taking vitamin supplements in the form of tablets, capsules, with or without prescription. In the chat box, if you are taking the vitamin pills, just to put yes or the alphabet Y. Yes, Mary Thomas. Ajarya Regu, no. My dear friends, please participate. Rama Devi ji and Murugesh ji not now. There are 22 people. Okay, Omna teacher, yes. Okay, Sridhar Krupaji, yes. Naveen, yes. Okay, fine. Yes. What I'm going to say, what I'm going to share is based on facts. If you eat a wide variety of foods, whole grain products, fruits and vegetables, dairy products, nuts, seeds, eggs, and meat, you don't need any supplements except vitamin D. Why vitamin D? In the past, we used to walk. Children used to go to school by walking, exposed to the sunlight. Now, no. People can afford to have car, office again, air-conditioned room, sunlight. Rarely they get sunlight. Vitamin D, the skin, it is the biggest organ that manufactures vitamin D. So vitamin D deficiency is very common throughout the world. So that's why I said that the other foods, if you take, you don't need any vitamin supplements. Ignorance and stupidity are the root causes behind the overuse or misuse of vitamins. Hypervitaminosis overuse is harmful to health. Many people are ignorant. Some people are stupid. It includes doctors also. There are many doctors who are stupid. I am a doctor, so I'm not sparing the doctor community. And some doctors are really ignorant about the harmful effects of hypervitaminosis. Because in the medical school, they don't teach us about these harmful effects. The fat-soluble vitamins, A, D, E, K, easy to remember, ADEK, dissolved in fat and are stored in your body. The water-soluble vitamins, C and B complex, like B1, B6, B12, niacin, riboflavin, and folate, dissolve in water. Your body cannot store them. So you need a fresh supply of these vitamins every day. Now, I'm going to start with vitamin A. The foods rich in vitamin A. Get the source. If you eat these food items, you don't need to take any vitamin supplement. Nothing. I don't take any vitamins except vitamin D. carrots, mangoes. That doesn't mean that you have to eat all. One of these. Pumpkins, spinach. നമ്മുടെ നാട്ടിൽ അതിനെ പറയും ചീര. Papaya, eggs, cheese, sweet potatoes, മധുരക്കിഴങ്ങ്, bell peppers, broccoli, milk, tomatoes, fish, herring, tuna, salmon, and liver, either beef liver or chicken liver. Now, impact of hypovitaminosis. If your body doesn't have adequate level of vitamin A, that is vitamin A deficiency, eye problems, vision impairment, and night vision, skin issues, skin problems like dryness and itching, infertility, reproductive. So young couple, they may not be conceiving if they are not eating enough vitamin A rich food. Growth issues, children, delayed growth and development, lower immunity and respiratory infections, frequently getting sinusitis, cough, could be if the vitamin A consumption is not adequate. Now, hypervitaminosis. If you buy vitamin supplements, assuming that more vitamin will give more health, that's not true. It is false. Vitamin A overdose, headache. I have seen in my practice some patients here. Here it is very common for the patients to buy vitamin supplements. Just before this talk, just 1 hour back, I talked to one of my neighbors. He's a white guy. And he's a retired chiropractor. He's a healthcare professional. I told him I'm going to give a talk on hypovitaminosis and hypervitaminosis. Do you take in vitamin supplements? Oh, he said, yeah. And I asked, how much do you spend for the vitamin supplements? He said that nearly $150 every month is spending on vitamin supplements. And when I was seeing patients, some patients, they used to have headache. Everything was negative. All the investigations, negative. Then, just like that, I asked, are you taking any supplements? I said, yeah. Then I asked him to bring all the supplements, put them in a brown bag, put them. I saw he was taking vitamin A, a high dose. Then I asked him to stop that one. Then the headache, just like that, disappeared within a week. So if you don't realize, the doctors also, they are not Sherlock Holmes. They are not going to find out. Then you will get a pain medication. The headache is because of vitamin A. Now you are going to get a medication for the pain, and that medication can have its own side effect. Do you get it? So that headache was caused by vitamin A. Muscle pain. Oh, these days, many old people, they complain of muscle pain. Blurred vision. High dose can also affect the vision. Nausea. Malayalamil parayum orkanam. Dizziness. So far, is everything clear? Whatever I have shared, if everything is clear, you have understood, in the chat box put why. I want to make sure that I am explaining things in an easily understandable way. Yes, Yajendranji, yes, yes, yes. Thank you. Yes. Now vitamin B1. The chemical name is thiamine. Thiamine-rich foods. Sunflower seeds. I take sunflower seeds every day. 1 to 2 teaspoons of sunflower seeds. Green peas. I eat green peas 2 or 3 times in a week. Lentils, black beans, soy products, brown rice, bran. I make puttu using bran and rice flour. Pork, I don't eat. Salmon, yeah, now and then. Flaxseed, yes, I eat flaxseed flour. Sometimes I make puttu with the flaxseed flour and rice flour. What will happen? If the thiamine intake is low, beriberi, that is swelling of the legs and heart failure, all those symptoms. That is very, very uncommon. Very rarely people get into that sort of a situation. Memory disturbance, my dear friends. Memory impairment. Confusion. Anorexia, loss of appetite. Weight loss. Then Wernicke-Korsakoff syndrome. This syndrome, vitamin B1 deficiency, alcoholics, they develop. So if you are an alcoholic, then you need to take vitamin B1 supplement. If you are an alcoholic, they may develop a very low level of vitamin B1, and then they develop dementia, psychosis, depression, everything as part of that vitamin B1 deficiency. That is called that syndrome. Then vitamin B1, no hypervitaminosis. That one is promptly excreted in the urine. Earlier I told you vitamin B and C, they are water-soluble vitamins. So vitamin B hypervitaminosis is not a problem, but hypovitaminosis S is a problem. Now vitamin B2, riboflavin, rich foods, mushrooms, and I eat mushroom again at least 3 or 4 times in a month. Almonds, I eat almonds every day. Some 3 or 4 almonds. Yogurt, yes, every day. Milk, definitely. Minimum 2 cups. Chicken, 5 or 6 times in a month. Eggs, frequently. My dear friends, don't be afraid of eating eggs. Eggs, you can eat with the yellow of the egg also, egg yolk. Don't be afraid. All this cholesterol, that fear. Don't worry. Avocados, that also I eat almost every day. Pumpkin seeds, yes, every day. I have pumpkin seeds. I have cashew nut. I have peanuts. I have pistachio. I have walnuts. I have papaya and dates. Wheat bran, again, vitamin B2. Soy products. Impact of vitamin B2 deficiency. Fatigue. Fatigue means feeling very tired. Feel all the time tired. Why? And വയസ്സായില്ലേ അത് കൊണ്ടായിരിക്കും. വയസ്സായത് കൊണ്ടായിരിക്കും. You think because of aging. You may not be, maybe because you are not eating adequate quantity or vitamin B2 rich food. Swollen throat, angular stomatitis. What it means is at the corner of the mouth, some kind of a break and some irritation and crack. That is angle stomatitis. Chelosis in the lips. Blurred vision again. Depression. Seborrheic dermatitis. In Malayalam, താരൻ എന്ന് പറയും. താരൻ. Vitamin B2 deficiency. These days, children, they don't eat. Dandruff. They don't eat. They don't eat healthy food. Their whole lifestyle, eating food habits are terrible. Children. Again, there's no, usually vitamin B2 also, no overdose or hypervitaminosis. Niacin, that is vitamin B3. Available in plenty in yeast, chicken, fish, tuna, and salmon. Brown rice, avocados, peanuts, very inexpensive. Mushrooms. Impact of hypovitaminosis. What will happen if the vitamin B3 is deficient? Again, tiredness. Poor blood circulation. Stomach issues, stomach cramps and pain. Depression. Pellagra, it is a combination of three things: skin rashes, that is called dermatitis, diarrhea, and dementia. Now comes vitamin B6, pyridoxine. Again, available in fish, tuna, salmon, chicken, chickpeas. Do you know what is the chickpeas? Kadala.
Kabulichana.
Kabuli. നമ്മുടെ കടലക്കറ പുട്ടിന്റെ കൂടെയൊക്കെ ഇത് ഉണ്ടാക്കുന്ന.
Not that one, sir. White chana. Chana masala.
Right, chana masala. So chickpeas, beef, spinach, sweet potatoes, bananas, potatoes, avocados, pistachios. Impact of vitamin B6 deficiency. Rashes. We required for good skin health. Vitamin B6 is really required for good skin health, just like vitamin A. Dry and cracked lips. Weak immune system. Numb hands and feet, especially already people, they have diabetes. Diabetes itself can cause numbness and tingling of hands and feet. And the medical concern we call the glove and the stocking type of symptoms. As we are wearing a glove, the tingling, numbness in the hands. As we are wearing stockings in the feet. So this is a very important vitamin. Its deficiency can cause lot of symptoms. Foggy brain, thinking again will be cloudy or clouded. Some people may find it difficult to think clearly. Anemia. My dear friends, anemia is not always due to only iron deficiency. Vitamin B6 and some other vitamins also, like vitamin B12. Sridhar Krupp sir last time asked me about vitamin B12. So that deficiency also. Sridhar Krupp sir, choichalla kainona. You asked me, right? Unmute.
Yes, I asked.
അപ്പം എന്റെ ഓർമ്മശക്തി ഉണ്ടോ? കഴിഞ്ഞ ആഴ്ച ചോദിച്ചത് ഇപ്പോഴും ഞാൻ ഓർത്തിരിപ്പുണ്ട്. So my memory is sharp. Okay? So, and നമ്മൾ രണ്ടുപേരും മറ്റേ പഴയ പി സുശീലയുടെ പാട്ടാണ്. പൂന്തേനരുവി നമുക്കൊരേ പ്രായം. കേട്ടോ? കുറുപ്പ് സാറേ.
കുറുപ്പ് സാർ ഓർമ്മിക്കുന്നില്ല. ചോദിച്ചായിട്ട് കുറുപ്പ് സാറിന് ഓർമ്മയുണ്ടല്ലോ.
ഓർമ്മയുണ്ട്. കേട്ടോ? അതുകൊണ്ട് ഒരേ പ്രായം. പക്ഷെ ചിലപ്പോഴൊക്കെ കുറുപ്പ് സാർ പറയും, പേരൊക്കെ തെറ്റിച്ച് പറയും. ചിലരുടെ പേരൊക്കെ എന്റെ പേര് തന്നെ 3 തവണ തെറ്റിച്ച് പറഞ്ഞിട്ടുണ്ട്. വേറെ ചിലരുടെയും ചില ഇതിലൊക്കെ എല്ലാം തെറ്റിച്ച് പറയും. അപ്പൊ അവിടെ മെമ്മറി അത്ര ഷാർപ്പ് അല്ല. ഓക്കെ. Anemia. Impact of hypervitaminosis. Okay, excess vitamin B6. Again, headache. Here, my own personal experience I'm going to share. Some 20 years back, when here the medical records they changed it to electronic medical records. Previously, we used to write the notes, the paper charting. Then they changed to electronic medical records. And you know, back home, I never learned how to the key, typing and all those things. If you are not good at typing, then you will be hitting each word with only one finger. That will consume a lot of time, delay. That will be frustrating. So for nearly 1 week, I was looking for where the key is, and then I thought, okay, let me learn how to type. I bought a typing tutor and putting the fingers in the right place, everything. It required a lot of practice and patience. Then after a couple of months later, I developed carpal tunnel syndrome. I don't know whether you have heard of this condition. Carpal tunnel syndrome is in the wrist, carpal bones. Those bones are called carpal bones. And there's a tunnel, just like the train going through the tunnel. The nerves, arteries, everything go through that tunnel. And there's a ligament over that one. And that ligament, with the aging, it loses the elasticity. You know, just like if it is elastic, yes, fine. If it is rigid, then it won't stretch. Then I was stretching, especially in the keyboard. The little finger every day we don't use a lot. But when you are typing, the little finger goes to press many keys. Do you know anything about the typing? There you use the little finger often. So that is stretching. So my carpal tunnel, by the age of I was around 50 years old. It won't stretch. Inflammation, pain, both hands. Then in my clinic, another colleague, a white doctor, I told him, look, hey, John, I'm having carpal tunnel. Take vitamin B6, pyridoxine, 200 milligrams. I said, 200 milligrams? Oh, yes, it will work. It will work. Okay. I took 200 milligrams. After some 5 or 6 days later, morning, I got up with severe headache. I was not able to connect the headache to this vitamin B6. I was wondering, why am I getting this headache? I checked my blood pressure, everything is fine. Headache. And the headache was not going away. I took the Tylenol, that is the paracetamol tablet, but it was persisting. Then I thought, what could be the reason? Then I did the Google search. Pyridoxine, 200 milligram. One of the side effects is headache. Okay? I developed a headache because of excess vitamin B6. I stopped, and within 3 or 4 days, went away. അതുകൊണ്ടാണ് ഞാൻ പറയുന്നത്, dear friends, some of you who are ignorant, who are not aware. I said, doctor also I was not aware. You may be taking vitamin B6 unnecessarily, and that can give headache. Ataxia. Excess vitamin B6. Ataxia means you lose balance, steadiness of the gait, unsteadiness of gait. You may never realize, if the doctor also is not aware you are taking the vitamin B6 in a high dose, they won't. They will send you for CT scan, MRI scan, and physiotherapy, this therapy, that therapy. It won't go away. It won't go away. Now, are you happy that you scheduled this talk? If you are happy, you must thank Sridhara Kurupuji. Are you learning something new and useful? If it is so, the chat box, yes, Musamilu. I haven't seen any doctors giving a talk on this hypovitaminosis and hypervitaminosis. Have you heard? Have you come across anybody giving a talk on? If you haven't come across, put N. If you have not heard before, N. So that is why the moment he asked me, I readily said yes. And that also I didn't delay. Okay, next week, I can give a talk. Polyneuropathy again. All these hands and everything, numbness and tingling, perip, മരവിപ്പ്, സൂചിയിട്ട് കുത്തുന്ന പോലുള്ള വേദന, pins and needles, vitamin B6 overdose. Now vitamin B9, folic acid. Peas, beans, legumes, citrus fruits like oranges, lemon, cabbage, spinach, broccoli, liver, seafood, eggs and dairy, milk, meat and poultry. Okay, what will happen? The vitamin B level is low. Again, anemia. Anemia will make you feel very tired, no energy, infertility, depression, dementia, decreased cognitive function, and Alzheimer's disease. Just think for yourself. Some 40 years back, was there any difficulty in getting pregnant after marriage? Most of them within 1 year, they would deliver a baby. Am I right? But now, how many infertility clinics? Artificial, that one. What is happening? Lifestyle changes. Now, do you get my point? Infertility has become a real growing problem. The root cause, eating habits, eating more junk food, not eating healthy food. Impact of hypervitaminosis B9, stomach upset, stomach pain, nausea, diarrhea, irritability, confusion, skin reactions. What will happen if if a person is taking the vitamin folate excess and getting the stomach upset? Obviously, he will go to a gastroenterologist. What will they do? They will pass the scope through the mouth, everything, all sorts of investigations, spending thousands of rupees. The pain won't go away because you are continuing to eat that folate. And the doctors, they are not going to discover or diagnose that one. And here what I used to do was, subsequently to all my patients, standing instruction, and my nurses also, they will always remind the patients, when you are coming for seeing Dr. Reddiar, please put all your medications, over-the-counter medications, without any prescription, inside a brown bag and bring that one. So my patients, initially they forget, but repeatedly telling every time when they come, they will bring whatever they are eating, taking. Then I go through that one, then I say, okay, no, you don't need it. You don't, no. And I will be able to diagnose correctly. There are some type of symptoms is due to overdose. My dear friends, please don't put any messages in the chat box. That is a distraction for me. During the discussion, you can share your thoughts, please. And seizures, that is epilepsy, fits. B12, cobalamin, rich foods. Liver, fish, sardines, matti or chala, salmon, tuna. Fortified cereals, most of the cereals and some bread also, they add the B12. Milk and yogurt, eggs. Impact of hypovitaminosis, this is serious. Vitamin B12 deficiency, dementia. Dementia. When we see a patient with a memory disturbance, we routinely order the vitamin B12 level. We check the thyroxine level routinely because hypothyroidism and vitamin B12 deficiency can cause reversible dementia. Anemia, fatigue and muscle weakness, again numbness or tingling in hands and feet, nausea, weight loss. What about excess vitamin B12? Headache. My dear friends, look at that one. If a person is taking a multivitamin tablet, many people take multivitamins, may have vitamin A, vitamin B12, vitamin B6, everything. Then, yes, the probability of getting headache is very high. Then you spend a lot of money seeing general physician, then the neurologist, then the ENT. Then, please mute your, please
Okay.
mute your microphone. Somebody's microphone is unmuted. So, everything, the real villain, vitamin. Many people, they don't realize, they think that vitamins are safe. No, nothing under the sun is safe. And these are the real side effects. Nausea, vomiting also. Now, the vitamin C, ascorbic acid rich foods, oranges, lemons, papaya, gooseberry, അമേരിക്കയിൽ കിട്ടത്തില്ല, നമ്മളവിടെ നെല്ലിക്ക, broccoli, strawberry, pineapple, and bell peppers. Vitamin C deficiency, bruising, easy. If you accidentally bump against somewhere, you'll find blood, clotting, bruise. And accidentally shaving cut injury, the bleeding won't stop immediately. Any trauma, more blood loss. And bleeding from the gum, when you're brushing the teeth, vitamin C deficiency. Gum and dental problems, dry hair and skin, again anemia. So hypervitaminosis, excess vitamin C. Some people think that it's safe, it is good for immunity, cold varathilla, it is protect. No. It can cause diarrhea, nausea, vomiting, heartburn, because it is acid, ascorbic acid. Stomach cramps, again headache. I told you the purpose of this webinar. Know the essentials about vitamins, know the source of vitamins, know the impact of vitamins, the impact of hypovitaminosis, hypervitaminosis. Now, dear friends, I haven't covered all the vitamins because too much information if I dump today, Tulasi Saubari will develop severe headache, information overload, and she will stop coming to my sessions in the future. So, I have covered 3 vitamins. Next session, if you are interested, if you schedule, I will talk about the DEK. Then it's not over actually. If you are interested, if you are really interested, you need to know everything about the calcium, iron, manganese, zinc, selenium. They are all, the knowledge is absolutely essential. So now the session is over. Just a minute. Upcoming talks on Thursdays, every Thursday. I give a talk, Zoom talk at 8 o'clock. Upcoming Thursday, Psychology of Greed, Atyagraham. Psychology of Expectations after that. And you can take a screenshot of this slide. The Zoom ID is same. Passcode is same. So I will leave it for another 5 seconds so that if you have to take a pen and paper to jot down that Zoom ID. For it easy to remember, the BSNL number in the past, it used to be 94470. Then the next 5 digits. So I have deliberately chosen 94470, then 92270. Passcode is 1234.
Pen and paper for old generation. Now they will take a screenshot.
Yeah, but that also some people they don't know. The other day when I asked them to screenshot, ഒന്ന് പറഞ്ഞ് ഞാൻ പേന എടുക്കട്ടെ ഇതെടുക്കട്ടെന്ന് പറയാൻ തുടങ്ങി. അപ്പോഴാണ് ഞാൻ വിചാരിച്ചു ഓക്കെ എല്ലാവർക്കും സ്ക്രീൻഷോട്ട് ഒന്ന് അറിഞ്ഞുകൂടാ. അത് കാരണം I thought of leaving it for a few more seconds. So Aditya, I would say that you want a session about the other remaining vitamins.
Yeah. We definitely need it, Dr. Venugopal. Let us have the coming Sunday and the week after.
But we are not getting enough time for taking the screenshot.
Now, what I am going to do is, I will share the PDF of today's talk, PowerPoint slide, PDF. I will be sending it to Prasadji. Prasadji, I have already sent you the PDF of yesterday's talk. Please share it with that Neelam Damija. She wanted that one.
Sure. I'll do that.
This also.
Yeah, please share it to me also. Please share it to me also.
Yeah, within the next hour, I will share the PDF so that.
Even to me, Dr. Venugopal, even to me, I'm Dr. Ramadhi Ambadi.
Yeah. If you have given that number to the Prasad Nagaraju, he will share it with you.
Okay.
Right. Because he can share. Because I don't. Some people, they don't like to share as if they hold it to it. No. And it will only be possible for you to remember whatever I told you today. If one time listening, if you can remember, my goodness. So the children, why do they sit and study for the exam? In the classroom, the teacher taught everything. They forget. Young age. So you need to review this one at least 2 or 3 times. If you want it to stay in your memory.
That is what Gita says. Abhyasayana tu kaundeya.
Right. And as I told you, I don't take any other vitamins. Nothing except vitamin D. And I eat every day fruits. Today also, before the talk, 1 orange, 1 pear. Morning I ate 1 banana with the put. Okay? So usually 3 fruits, seeds, nuts. So by God's grace and because of my healthy eating habits. In Malayalam, there's a saying, Prasadji, there's a saying in Malayalam, I'll translate it into English. Tan Padi, Deivam Padi. That is 50% in my hands, 50% God's grace. That 50%, I make sure that. And I'm not an alcoholic. I don't drink even wine. I don't smoke. Everybody can do that one. My son is here. I will ask him to briefly turn on his camera. Anna, why don't you turn on his camera? Just, he is here. He is 31 and he was in India till 4 months back. He was in Mumbai. He also doesn't drink alcohol. Parenting, very important. If the parent drinks 1 or 2 pegs, the children will drink 3 or 4 pegs. Okay? So then you are giving advice. No. Don't drink that much. 1 peg is okay. Because you see, I drink only 1 peg. That's not going to happen. So be a teetotaler. He doesn't drink alcohol. He doesn't smoke. And because of that one, he is unpopular. I am also unpopular. In the Mallu community, when I came here beginning, they used to invite me for the children's birthday party. Then I went there. Red label vano, blue label vano, Johnny Walker. Then I told her, no, I don't want that one. Kudikkathille. Surprise am. Shock am. Kudikkathilla ennu parayunnathu enna? ഞാൻ പറഞ്ഞില്ല വേണ്ടവർക്ക് ഒരു പെഗ് അടിക്കാൻ ഡോക്ടറെ ഒരു കമ്പനിക്ക് ഒരു പെഗ് no sorry well if you have plain water or orange juice or anything
white water
അതിനുശേഷം അവരവരുടെ പിള്ളേരുടെ ബർത്ത്ഡേ പാർട്ടിക്ക് എന്നെ വിളിക്കാറേ ഇല്ല and they bring after the birthday party some pizza or something like uncle മറ്റേ എന്റെ മോന്റെ ബർത്ത്ഡേ ആയിരുന്നു എന്നെ വിളിച്ചില്ല അങ്കിൾ വന്നാൽ ശരിയാകത്തില്ല അങ്കിൾ ഒരു ഗാന്ധി ടൈപ്പാണ് അങ്കിൾ അവിടെ വന്നാൽ ശരിയാകത്തില്ല so my social life is screwed because I am a teetotaler. My son also, he experienced that one when he was in Mumbai. But my health is more important.
Excuse me, Venugopal sir, non-Malayalis are here.
That is why most of the time I shared in this one. Occasionally I am sharing this one. Even if they miss this one, nothing is going to happen. Okay.
Let us have a clap for the session.
Right.
Yeah.
Thank you.
Yeah. Dr. Venugopal, I have a question.
Sure.
About especially the vitamin B's, B12, which for vegetarians, there is, from the food source, it's very limited.
Right.
What is your recommendation?
That is where that one vitamin B12 fortified cereals. Right now, many cereals, they have vitamin B12 added to that one. That is a good source.
Yeah, it may be available in the US, but I have not.
No. I think that it is available there also because the brands again, the US brands are available there. All these
cereals are available.
Right.
Available.
Okay. I need to do some research on it. Okay.
Right. Please go ahead and do that one. Vitamin B12.
Kerala government is doing some fortification in wheat flour and all because children deficient in vitamin, they are doing it in flour, wheat flour, fortified.
Okay.
Yeah, rice bran oil, rice bran powder, all are available nowadays.
So anything. At times, I find what is not available in USA is available in India.
Yes,
okay.
I have come across one suggestion for vegetarians is kanji, soaking the rice in the overnight and then early in the morning having it with the yogurt and something. Yeah, this one they say is good for vegetarians and it's a good source of vitamin B12.
Old ganji.
Prasad sir, earlier this was the Malayalis food, but now they change it, copying the European style. Earlier, paranganni with the China small green chili,
energetic.
spicy.
Sir, I have one question, sir.
Okay, go ahead.
Yes, sir. Even if you may take sufficient vitamins, and if it may not, our body may not absorb, what we can do?
That one, extremely rare if you have got a malabsorption. That is a condition called malabsorption, diarrhea. They will have diarrhea and all those things. Such people, then give the vitamin supplement either in the form of periodic injections. In the past, they used to take, that is a neurobiome injection, that is vitamin B1, B6, B12 in the past. Otherwise, most of the time, no. Then vitamin B12, yes, that one. Another, Prasadji, last week I mentioned, the acid in the stomach, the absorption depends on acid in the stomach, even iron absorption also. And in the past, people used to drink Gelusil as an antacid, that pink stuff that will antagonize and neutralize the acid. Now they are taking the tablet, then came cimetidine and ranitidine. They are called H2 blockers, that receptor blocker. Now they are using the proton pump inhibitor. One brand name, but available in India is PANSIGHT. PANSIGHT. And many people, they take it every day for months and years together. That one stops the acid secretion. No acid. And God, Upperwala, the acid purpose is there. That is to even protect you from infections. The acid, the bacteria, they get killed. So by taking this proton pump inhibitor daily, no acid secretion, even if you take the vitamin B12 capsule, it won't get absorbed. So stop taking the PANSIGHT, look at that one, or that one if you are taking, and one should not take it usually for more than 4 to 8 weeks. Self-medication. Biggest risk is self-medication. Many people doing the Google search and other things, consulting the Dr. Google and the WhatsApp University, everything. That is actually really screwing the health of people.
Sir, I have a question. Sir, I have a doubt, sir.
Okay.
Can I tell?
Sure.
Sir, infertility patients, no, they are continuously taking folic acid. What is your opinion?
Now, infertility, first, the whole workup they should do. Workup, that is when, for the men, the sperm count, sperm motility, and the women, uterus, polycystic ovary, diagnosis first. If they are all fine, then normal diet. Folic acid is required during pregnancy if a patient is not taking, pregnant person is not taking adequate enough of folic acid. If they don't take, spina bifida is a spinal deformity, birth defect, the children. So folic acid, they recommend again just 1 milligram only, not more than that.
Before getting, they are continuously taking folic acid.
No, that is yeah. Don't do that one. Don't do that one. Yeah.
That's what I'm asking.
Yeah. You have to find other causes. And another thing also, this is also reality. The boy and the girl, they were having conflict. They were not even on talking terms. So they were not even having sex. And the mother-in-law goes to do all the puja, and she brings this one, everything that is for pregnancy. When they are not having sex, how can you expect the pregnancy to happen? Okay? Then they go to the astrologer. Astrologer say, Jova, until and unless that relationship changes, nothing is going to happen.
Myself and Dr. Rama, we are treating infertility cases more. So the patients who comes from after IVF, after IUI, so many other allopathy medication or Ayurveda medication, they used to tell they are right from the beginning of treatment, they were using folic acid every day they are taking.
No.
So should we advise them to take continue or only pregnancy you have to take?
During
That's what
pregnancy only, otherwise, pregnancy again 1 milligram. Otherwise, in the diet, the folate-rich food, eat that one.
That
The choice, different, something.
Okay.
That's all required.
So we can tell them to stop that folic acid.
Right. Yes. Folate comes from the green leafy vegetables. Most of these cauliflower and broccoli, everything rich in that one.
What about vitamin E, sir? EVO tablet.
Next talk, we are going to come to that one.
Okay, okay.
P-E-K.
Okay.
Next.
Thank you so much.
Can I ask only? I am
Okay.
taking thyroid 75 every day for thyroid.
Okay.
Deficiency. Thyroid 75.
Okay, I got it. Okay. So what is the question?
I am taking every day.
Okay, that one is a totally different. It is not a vitamin. That is a hormone replacement. That is if there is a thyroid deficiency, thyroxine, you have to take it for the rest of your life. Because your thyroid is malfunction. It is not producing that one. So you need that one. So today's talk is not about the thyroid. Today's talk is about vitamin.
Okay, sir. Thank you.
Yeah, can I ask the question?
Oh, sure.
Yes, sir. Sorry, forgive me. It's not like that. I am not attending your session because even morning time is my time. So evening time having some guests, everything's that's why, sir, I am not able to attend. So forgive me. I'm really missing your sessions.
I won't forgive you. I won't forgive you because there is a Malayalam saying. For the sake of Prasadji, I will translate that one. Venamengil chakka verilum kaikum.
Where there is a will, there is a
Madam, you are powerful and your reasons are powerful. Yeah, that is the way you are justifying.
Right. These are all excuses. You will give some other priority. No. No. Because
a priority, it's not like that, sir. But because I am a part of the session, that's why I have to there. That's right.
That 1 hour.
That's right. Sometimes
1 hour. You delegate.
Like
you ask somebody else that one.
Yeah.
You ask somebody else.
Right. Now I will delegate.
Delegate that one. Time management.
So, one more thing, Prasad sir told about the paranganni. So I will show this those who are not knowing the 1 minute. I will change
before that one, for Prasadji, the Malayalam what I said, Venamengil chakka verilum. You know the jackfruit? Jackfruit can come from the fruit, okay, not from the tree.
Yeah. Sir, nowadays it's on the root only. All chakka.
So Venamengil. And there's an old saying, where there is a will, but the Srimarji shared, where there's a will, there's a way.
Yeah. Sir, this is the China parangi. Very good for cholesterol. So earlier Malayalis were having paranganni. This previous days rice, curd, salt, and this chili. We were having like that. But nowadays for the people, people are saying, he is a paranganni. No needs to talk to him. Like that way people are making fun. But they don't know the value of this paranganni. It's very good for
Malayalis are very good at mocking, criticizing. That is their expertise. And I gave a talk on stupidity, psychological stupidity. The SQ, that stupidity quotient is very high among most of the Malayalis, not all. If I say all, then I am prejudiced. But a significant number of people, their stupidity quotient is very high. Okay? And
one more thing, sir. I would like to show this flat seeds. So those who are not knowing about, I don't know whether it is visible or not. Very good for omega-3 as 3 fat acids. So I am taking it for a long time. I grinded it and added in the salads and also chapati atta. I am adding it.
Very good.
Yes, sir. Then this is the sunflower seeds, as sir told. Then this is the watermelon seeds.
Good.
And this is the pumpkin seeds.
Very good.
Yeah. Then also I am having 1 walnut, 2 badams, 1 cashew, 2 pistas. Then what else?
Prunes.
What is that? I forgot. Yeah, so these are it's very good filling for our stomach. If we are taking in the early morning empty stomach,
fig,
till afternoon, yeah, fig. Till afternoon, don't think about any other food because that much filling, all these things.
Now, friends, I
Yes, sir.
eat cooked food only twice a day. Morning breakfast, then lunch, evening, only uncooked food. That is the fruits, nuts, seeds.
Yeah.
That is all.
Me also reducing weight now. Nowadays, I am more focusing on vegetables and fruits. Reduced rice. No, I like the rice very much, but those things I reduce, avoid it now. Wherever I am going, when I am seeing the function, marriage function and all, I like biryanis, but I am not focusing on that. I will turn my face to the salad region. Then I will fill my stomach first with the salads. So whatever food I like more.
Tulasi ji,
Yes, sir.
Tulasi ji, occasionally eating biryani is fine, no problem. Occasionally eating ice cream is okay. Occasionally eating payasam is okay.
But in Kerala, sir, every now and then we are having functions. That's the problem.
Oh, then that's a different thing. And
now Kumbh Meena Masam, we don't have that much functions, but otherwise every time we are having
Tulasi ji, a simple exercise for those who want to lose weight. Very simple exercise. This will take only 1 minute. 1 minute, yes. Prasad ji is showing that exercise. When somebody is offering the sweets and all those things, neck movement, left to right. And something else, you want to know?
Yes, sir.
That is all required for weight loss. Okay, this exercise.
So wherever I go, I am asking them, please don't think about the food. I am not giving more importance about the food and all. Anything is okay. Fruit is enough for me. Like that way I'm saying. Then they are saying, then what you are eating? You are not eating anything. Day before yesterday, I went to doctor for having my spondylitis. Then he was asking, why you skip the rice? Then I told, I liked more. That's why I skipped it. Because it's rice with mean curry, rice with mori curry, everything like. Yesterday, I told my son, if I am in the last stage of my life, if I am asking anything, you give me some food, rice mixed with fish curry or anything, give me. I will eat. He's asking, why you are waiting for the last one? And I told, not like that. Because rice.
So Jesus Christ had the last supper. So Tulasiji's last supper, she will have Paranganyi. Last supper.
Yeah, sure. Ganji I like more, sir. Ganji I like more. The quantity will be more if I am taking Ganji. Because
Gangajala alla vendam.
No, sir. Gangajala nothing. No important, sir.
Tulsi madam.
What is the need of last having Gangajala? If we want Gangajala, take now itself. Don't wait for the last moment. Sir, what
I was in Benares for some 3 months in the BHU, Benares Hindu University. So I went to the Ganga at that time. Now it is totally different. To take a dip. When I saw the dirt and everything, I didn't even step inside the water. And when you are talking about Ganga gel, my goodness, the gel is coming from that one. And I met one Dr. Reddy, who was a professor there. And he told me they took the water and the bacteriology, culture, everything. It was full of plenty of bacteria. Okay, Ganga gel. Okay, now last before they die, give the Ganga gel, give all the bacteria, and that is what is happening. Okay.
Now it is a different story.
No, you have to take it from Gangotri.
Yes, sir. Last moment getting a drop of water, that itself is a Ganga. No need of going to Ganga and for collecting this one. Sir, I have a doubt.
One request to everyone. Please, others unmute. There is a background.